Good afternoon, everyone. My name is Nina Thomas. I am a biomedical informatics consultant in the Data Core Division of the Department of Biomedical Informatics. I'm here to talk to you about how you can access data for research purpose. There are a few ways in which you can access the data. So let's take a look at a few of them. The first one is called submitting a research data request. You might have heard of this mentioned as an IW request. Some people call it IHIS data request, an honest broker request. So whatever data request that is used for research purpose, this is the method that it follows. So what it provides you is, it facilitates access to data from our EHR, which is IHIS or EPIC, as well as pre-IHIS data that resides in IW tables. So broadly classified research data can be classified into two, PHI and non-PHI. PHI stands for Protected Health Information. So if you are looking for PHI data, you need an IRB approval. If you do not have an IRB approval and you would like to do a feasibility analysis, or you know that your research request only needs de-identified data, then you can submit an aggregate data set, which is just a count data that you will receive, a de-identified data set where there are no elements of PHI involved. So if you're requesting, say, I want a de-identified data set of MRNs, medications, visits, etc. Instead of MRNs, you will get a de-identified MRN. Instead of any dates that you're requesting, you will get a shifted date. So that is essentially a de-identified request. And also in this request, you cannot have any patients who are 90 years old or older. If you would like a de-identified request, but you want to get more details, like say you want the exact dates, or you want zip code, which is a PHI, or you want to know patients who are above 90 years, then you can request a coded limited data set. This will provide you that. So bear in mind that both de-identified and coded limited data set, it is a one-time data pool. You cannot get longitudinal data out of this. So for a coded limited data set, if you would like to get a longitudinal data, you will need to go back for an IRB approval before you can get the next set of data. So the PHI elements, I just put it in there so you know there are 18 elements of PHI as defined by HIPAA, or the Health Insurance Portability and Accountability Act. This came in mid-90s. President Clinton signed this. So the elements are, as you might already know, like names, zip codes, dates, phone numbers, any email address, SSN, medical record numbers, any other identifying numbers, web URLs, IP address, pictures, biometric identifiers, or any other unique characteristics. These all comprise of the 18 elements of PHI. So if you need any of this as part of your request, you would need an IRB approval. Within OSUWMC, if you want to do research, any data, an analyst can provide you the data. It needs to be approved by what is known as the Honest Broker Operations Committee, or HBOC. So without this, an analyst cannot pull the data for you. So what is an honest broker? Honest broker is kind of a disinterested third party. They look at the patient's interest as well as the researcher interest. They kind of serve as a delicate balance between the patient privacy as well as the researcher's productivity. So any request, be it de-identified, coded limited, aggregate, IRB approved PHI request, imaging request, where you need imaging data that does not reside in EPIC or in IHIS, but the imaging informatics team collect this data, those kind of data, or finance data, which is again not captured in IHIS, but OSU finance team keeps track of all the hospital finance data, or if you need cancer registry data, which is not captured in IHIS. If you need any of this data, this is the method to follow. Submit an honest broker request or the research data request. So if you are submitting for an IRB approved request, there are two kinds of waivers, HIPAA waivers, that are associated with IRB. There is a full waiver and there is a partial waiver. So a full waiver is required by IRB to deliver the PHI to you. So when you are submitting an IRB, please specify all the data elements that you think you might need in your IRB. There is a field in your IRB application where it says specify the PHI elements. So please specify MRN, I need visit date, I need lab date or labs, or attach a data collection sheet as an Excel spreadsheet. Just specify what all fields you need in the spreadsheet and attach it along with IRB. This is the single most thing that delays the delivery of data to you, because people will submit their IRB and they might say, hey, I need medications of patients who meet all the criteria, but they might have forgot to put MRN in it. Without that, honest broker will not approve it. So please make sure that you specify all the PHI elements in here. The partial waiver, HIPAA waiver, is if you are interested in recruitment. So for recruitment, you would need partial waiver as well as written authorization. If you are interested in recruitment, one thing you have to keep in mind is you cannot cold contact patients. Someone who already has an established relationship with the patient, that is the only person who can contact a patient. So it is a provider. So you would basically need a provider permission before you can contact a patient. This is not an IRB rule. This is an OSUWMC privacy, HIPAA privacy rule. So when you put in a request saying, hey, we are interested in recruitment, we will tell you, we will ask you, how do you plan to contact the patient? Are you going to get permission from the provider? Then you need to tell us that, yeah, we are going to call the provider and get their permission. Or if the provider is not in OSU anymore, we will get the permission of the department chair or someone who is eligible to give that permission. Recently, as Nicole has mentioned, MyChart has been approved for recruitment. If that is the case, you will specify in your IRB that we are using the MyChart recruitment method to contact patients. And then when you submit the request to Honest Broker, the analyst will pull the MRNs and they will not send you the MRNs directly. They will send the MRNs to Nicole, and then Nicole will send a message through MyChart to all the patients. Those patients that say yes, then only for those patients, the coordinator will get an in-basket message. If you use this message, no other provider permission is required for recruitment. So we just got our first data request last week based on this, and it was approved. And we have pulled the MRNs and provided it to Nicole. So that's going forward. Then the Honest Broker Operations Committee, it meets every week, every Monday, and we have representatives from the Privacy Office, Legal, Information Warehouse, James, Quality, BMI, and Imaging Informatics. The committee is co-chaired by IW and BMI. So they take a look at all the requests that have come through that week. When you submit a request, it comes to the biomedical informatics team. We triage the request, and if we feel that the request is complete, we submit it for approval. So kind of the data, how the research data flows is, if you need data, if it is for research, you are certain that the data that you need is not for research. You need it only for a quality purpose or for an operational purpose. At that time, all you have to do is submit an e-service request, and the appropriate team will work with you to get you the data. But you think that this is for research, then the question is, are you requesting PHI? If you are not requesting PHI, submit the data request form. If you are requesting PHI, next question is if you have IRB approval. If so, submit the request. If not, you have to submit the IRB with ORRP, and once it gets approved, submit the data request form. The data request form, it's called Research Data Request Form, and it is available on the CCTS website as well as the BMI website. You can search for Research Data Request Form and you should see that. If for some reason you're not able to find it, please contact us. You can always reach us at cctsiwrequest@osumc.edu, and we will work with you to get you the data. Any questions on this? All right. the next set of data that you can access for research purpose. This is called OSU PCORI data. PCORI, some of you might be familiar with it. PCORI stands for Patient-Centered Outcomes Research Institute, and it has a clinical research network known as PCORnet, or Patient-Centered Outcomes Research Network. PCORnet consists of a lot of partner networks inside it, and one of the partner network is called PATH network. We are a member of the PATH network. That is how we have joined PCORI. So we actually joined PCORI in 2015 as part of a network called LHSnet, or Learning Health Systems Network. But recently we have moved on to a different network called PATH. So as part of PCORI, what it does is, it specifies a data model known as a common data model, or the CDM, whereby data is pulled from each of the individual EHR and they put it into a structured format. So in the case of, this is a distributed research network. What it means is that the PCORI data resides at each of the individual member site. So OSU's data resides here, and another member, say Mayo's, their data resides at the Mayo site. And all of these sites pull the data from our EHR into 19 different tables. So there are over 16,000 tables in Clarity, where it's a huge repository of data, but PCORI is kind of simplifying what all data might be required and putting it into these 19 tables into a standard format. This ensures that whenever they send a request, you can respond very quickly to it. A same query can be run against all the different member sites, and they will get consistent results. So one of the advantages of PCORI is that PCORI has our IHIS or Clarity data, as well as OSU health plan data. So in PCORI, there are two tables for medications called prescribing, which is entirely OSU health plan data. This is not something that you get when you put in an honest broker request. Then for PCORI, the data is available from November 2011 onwards, which is essentially when IHIS went live. We have a SAS, the approved PCORI CDM is in a SAS format, and the PCORI approves, has a process called data curation, which it runs maybe every 3 to 4 months. So the last data curation happened in January. So our current PCORI data is from November 2011 to January 17th, 2019. So it remains static till the next data curation happens. This is the results that we have in the database during our last data curation. We have around 1.1 million patients, and we do populate most of the tables, but there are a few tables like PRO-CM, which is patient reported outcomes table. There are some tables like that that we are not populating currently. Maybe in the future we might populate these. So these are the different data elements available from PCORI data. You have the encounters, medications, both prescribing, which is from EHR, as well as the dispensing, which is from the health plan. We have diagnosis, condition, procedure, death, labs, and vitals. And all of this is matched into a very simple demographic table, which is joined to the patient ID. The patient ID in there is a de-identified patient ID, but the birth date and all the death date, all the lab dates, they are all the actual exact dates. So this is essentially a coded limited data set. So as part of PCORI, you are eligible to request data from the National PCORnet website. If you would like to use it for feasibility review, or data, you want to see what kind of data is available with all the other member sites, what you would do is you would go to PCORnet.org front door. It is called a front door request. It is a request form, and you fill the request, and you can say, hey, I would like to know how many patients are there in your institute who follows this criteria. So when the coordinating center of PCORI is Duke, when they receive a request, what they do is they review the request. If they feel that it is okay to approve the request, they will work with the requester to write a SAS query. And this SAS query is then pushed to all the member sites. The member sites have the choice to either respond or not respond to the query. If we decide we are responding to the query, we will run the query in our against our database, and then we upload only the results back to the coordinating center, and the coordinating center will send it back to the requester. Till now, this is a free process, but in the future, it might change, and this takes some time for the submitting the request, the coordinating center to take your request, approve or request. All those things take some time.
Can I ask you a question?
Sure.
Why would one of the centers not run a query?
Sometimes we do get queries that have some kind of sensitive information, say how many transgender patients who have HIV who came to a clinic during the last month. So the count would be too low. So at that case, there is no way that we can respond to a query. There is something known as a threshold count for all data requests. The national threshold count for all data is usually 11. PCORI actually follows that threshold. So if anything falls below 11, we usually say that, hey, we are not responding. We don't have a big enough data set to respond to that. For honest broker requests, the threshold is actually 25. And that is a standard that OSU adopted just for honest broker, but 11 is the national standard. Then Popmednet, it's just a query engine using which PCORI pushes the query to each of the member site. So we receive it through what is known as, this is a web client. We receive the request through here, and we run the request and we upload the results back through Popmednet, and that's how the coordinating center receives the data. OSU PCORI Protocol. So based on this, any researcher within OSUWMC is eligible to access this de-identified data that is in a PCORI CDM. As I mentioned before, the threshold is 11. No separate honest broker is required. It does not need an IRB. And the requests are serviced under counsel of the OSU PCORnet Governance Committee. Dr. Soledad Fernandez is the OSU PI for PCORI. And we meet every 2 weeks to discuss what's going on for the national studies as well as studies within OSU. If you would like to request data from OSU PCORI data, there is a data request form called OSU Count Data Form. This is available in the BMI website. It is a simple red cap form where you are essentially requesting, hey, what kind of data you need, similar to the honest broker data form. If you have any questions about PCORI, you can contact pcori@osumc.edu, or you can email me. Any questions on PCORI?
So make a request to the whole network. Where is that?
PCORnet.org and front door. Keep in mind, it might take time. Sometimes it takes up to 6 months for them to even look at your request. All right. The next place you can get research data is called I2B2. This is only count data that you can request using I2B2. It is not requesting. It is essentially a self-service query tool. If you have access to I2B2, you will log into I2B2 and you get a query portal where you will drag and drop the data elements that is available, and then you will run the query by yourself. This is very quick. You can do it from your desktop or your laptop, and you can change the conditions that you're using to get the count. So this enables for feasibility analysis, and also you can see what kind of data elements are available for research in I2B2. So if you are a faculty or staff at OSUWMC or one of the 7 OSU Health Sciences College, you can have access to I2B2. So if you're if you are in one of these departments and you would like, go to i2b2.osumc.edu, and you see that you do not have log in with your MedCenter credentials. If you see that you do not have access to I2B2, go to Buckeye Learn, search for I2B2, and there is a small 20-minute, you have to learn. A training is available for 20-minute training. At the end of the training, you have to write a test. And if you get a passing score, you will get access to I2B2. Once you log into I2B2, on the left-hand side is where you see all the data elements that are available through I2B2. So you have the demographics, the diagnosis, encounters, labs, medications, and you can click on each of this and see what kind of data is available. You can also click the find and search by an ICD code or a CPT code or a diagnosis name to see if it is available. And once you find that, you can drag and drop it into the right-hand side of the query tool. So here what I've done is I've put a diagnosis code for cerebral infarction, and I've put it into the first column, and I have chosen a date of March 2018 to September 2018. If I simply run the query now, I get all the patients who had that diagnosis and who had an encounter between that date. But I want to say I want to add more conditions to it, then you put the conditions into the next column. That becomes an and condition. So I'm looking for people with cerebral infarction and who are African American or Asian Chinese. So whatever you put in the same column becomes an or condition. I'm again putting and one more condition in here. I'm adding cerebral infarction again, but I'm actually excluding cerebral infarction for the month of April, to exclude patients who had that diagnosis in the month of April, and just running the query. So you can play around with it and see what kind of data that you are getting from it, and to help with your feasibility study. The limitations of I2B2 are, I2B2 is on a 5-year slide, and not all data points are available in I2B2. Essentially, we are pulling data from our EHR, which is vast, and then putting it into this small thing called I2B2, and it follows the I2B2 ontology. So when you are translating data, such big data into such a small, to fit into such a small criteria, some of the details are lost in translation. So sometimes you find that when you're looking for certain counts, the counts that you get from I2B2 might not be what you were expecting. If that is the case, please reach out to us and submit an honest broker request so that we can write the query by ourselves and run it for you and get the counts for you. So utilize I2B2 for big picture queries, but then use the EHR query tools like honest broker request or PCORI data request to get more information of the data set that you are requesting. So I'm comparing the three methods that I talked to you about. So the research data request is the best one. It just would take a little bit time for you to get the data. It takes at least 1 week for the honest broker to approve the data request after we receive the completed data request. Then after honest broker approves, it is assigned to a team, and then the analyst has to work on it. And if there are a lot of requests that are pending, it might take longer. But usually for simpler, smaller requests, you should be able to get some kind of data within 2 to 3 weeks through honest broker. The threshold for research data request is 25. Then OSU PCORI data, it goes slightly faster than honest broker request because there is no wait period for it to get approved. And also the threshold is lower. But keep in mind that this is a static data set for the 3 to 4 months. Not all data points that are available in EHR would be there in PCORI. I2B2 is very quick, and there is no threshold. You can get count as low as 1 if you're using I2B2. I also want to mention another tool that you might have access to if you are a physician. Currently, this is available only to physicians. If you are a physician and when you log into your iHIS, you can search for a tool called Slicer Dicer, and Slicer Dicer will provide you the data. It is a self-service tool. You will drag and drop. You have to type in the variables that you are looking for, and then you can drag and drop into the query tool, kind of like I2B2, and you will get the counts, and you can compare cohort population in Slicer Dicer. you are eligible to use the dicer data for feasibility analysis. But currently, it's only available to physicians. And in the future, the study coordinators might get access to it. So see if you have access to it, and if you have, you could use it. And I also want to mention that BMI provides office hours every week, every Wednesday from 1 to 3 p.m. for I2B2 and EHR data. If you have questions on PCORI, please reach out to me. Any questions about any of these? Yes.
Does I2B2 produce data that we can use without IRB?
Yes, I2B2, yes, you can use it for, it is only counts that you're getting from I2B2, yes. And you can use that count when you're submitting for your IRB, you can say, hey, this is the population I got from I2B2. So, yeah.
How does the depth of information from slicer tracer compare to I2B2?
So I2B2 is a 5-year slide, data is on a 5-year slide. Slicer dicer data is, Epic provides it, we do not do any, we are not doing anything on it. So Epic is actually pulling from the EHR and providing the data to you. The ontology on slicer dicer is slightly different than what you might see in I2B2. So there you have concept IDs, and you are essentially searching for concepts. And some of the physicians that I talked to, they mentioned that slicer dicer is more intuitive to them rather than using I2B2. So it might be useful.
Okay.
Yeah. Any other questions? All right, thank you.